Namaskar. I'm Dr. Monika, Meena, consultant Gynaecology, Superspeciality Hospital, Howrah. And as September is being celebrated as Prostate Cancer Awareness Month, we have with us Dr. Tarun, Jindal, Head and Senior Consultant, Uro-Oncology and Robotic Surgery, Superspeciality Hospital, Howrah. So regarding this prostate cancer, we have few questions for you, sir. We would like to ask regarding the prostate cancer, how common is it and which is the most common age of presentation of the same?
So prostate cancer is considered to be one of the most commonest cancers in aging population of males. The age which is at risk is anybody who is beyond 60 years has a definite risk of prostate cancer. The aging per se itself is a phenomena by the virtue of which the prostate size grows up, and because the size grows up and because of the nature of aging per se, these cells mutate and they have a chances of developing into cancerous nature.
Okay, so what are the common signs and symptoms that patient presents with the OPD?
So if it's an early disease, there are no specific signs and symptoms, but usually the kind of patients which we see in our OPD who have been diagnosed as prostate cancer, they presented to us with specifically urinary issues. So the common urinary issues by which the patients present to us are frequency, that they have to void multiple times, urgency, that they cannot control their temptation to void. So if they have to void, they have to void, otherwise they leak in their pants. The other issues are nocturia, so they have to get up again and again in the nights to void. So these are the common symptoms. Some people might even have hematuria, that is blood in urine. The patients who have an advanced prostate cancer, they present with backache, pain in the neck. So the tumor generally goes to these areas, so they are not even aware why they are having this. They have a long standing backache, and during the evaluation of which somebody did an MRI and found some lesions in the spine, and then retrospectively it was found that the patient actually had prostate cancer. So these are the varied presentations, but generally the cancer does not have any specific signs or symptoms.
So even the slightest urinary disturbances, you suggest that the patient should come and report to you?
Yes, certainly. So any aging person will have some urinary issues. So if the urinary issues are becoming bothersome, rather than neglecting them, it is always advisable that the person goes to see a doctor. So it doesn't mean that this person will certainly have a prostate cancer. It is very, very common that he might have just a benign enlargement of the prostate, but certainly a patient should get himself screened whether he's suffering from prostate cancer or not, which might be just hidden and lurking around the bush.
And what all investigations or the blood test or the radiological investigations you actually resort to in such patients?
So once the patient presents to us, we do a clinical examination. So the most important examination that we do is called a digital rectal examination. So we feel how the prostate is. So in the sense that what is the size of the prostate, what is the consistency of the prostate, whether the prostate is painful to touch or not. So there are multiple factors by which we say that this prostate might be infective, or this is just an enlargement of the prostate, or this might be towards cancer. So any prostate which has cancerous element in it tends to be more firm or hard in consistency, tends to be more nodular in consistency, irregular in consistency. Apart from the digital rectal examination, the most common test which is given to these patients is called the PSA level. So depending upon the findings of the PSA levels as well as the clinical findings, so we do adjunct both the investigations, both the interpretations, and then we tend to decide whether the patient might be suffering from prostate cancer, or this is just an infection of the prostate or just an enlargement of the prostate.
So does this have a familial inheritance as well, like these cancer runs in family, or it is
certainly? So yeah, interesting question. So it has been found that approximately 20% of the patients might have a familial history, which they might even not be aware of. So in the sense that prostate cancer means a father should be having prostate cancer or the grandfather should be having prostate cancer. This is the general tendency, and this is general question we ask. But certain families have BRCA gene positivity, so the father or the grandfather might not have had prostate cancer, but other persons in the family might have had colonic cancer or breast cancer, and that gene per se manifested in this particular index patient as a prostate cancer. So yes, there is definite genetic linkage of prostate cancer, and now the recommendation is that if you have a person who has a metastatic disease, that is if the prostate has gone inside the body at multiple places, just not restraining to the prostate, it is recommended that we do the genetic screening, which might be important for us to decide the treatment for this particular patient else, and along with that it will also be helpful for screening the entire genetry of that particular index patient, so that we are able to counsel the family also.
So is there a specific age at which the screening should start in such patients who have the familial risk?
So if a patient has a familial risk of prostate cancer, then we recommend the screening should start as early at the age of say around 40. There are certain guidelines which say that you can even start the screening at the age of 35, which I believe is slightly an overkill, but 40 is a reasonable age at which you should start screening if you have a familial history. If there is no familial history, then also the male population is definitely advised to get their screening done from from the age of 45 or 50. If they are not having any symptoms. If they are having any symptoms, then the message is definitely they should see a urologist to screen them, to treat them, as well as to rule out the possibility of prostate cancer.
Right, Dr. Jindal. So Dr. Jindal, my next question to you is that how do you go about it, as in what radiological investigations like the MRI or the PET scans, or there are so many
Right. So it's now becoming very common that these patients come to us with a PET scan, but the step of investigation would be that there is a particular algorithm which we need to follow. So first we do a digital rectal examination, do a PSA screening, we corroborate both the reports with our clinical evidence, and then we decide whether further investigations are required or not. If the further investigations are required, it is prudent to go for an MP-MRI, which is called a multi-parametric MRI of the prostate. So it basically gives us a grading. So this is called a PIRAT score, so 1 to 5, by the virtue of which we decide whether we are dealing with a benign prostate or we are dealing with a malignant prostate. So if we are dealing with a malignant prostate, the next step after the MRI would be to confirm our biopsy. So we do a transrectal biopsy. If it excludes cancer, we are done and dusted. If it says that this is cancer, then we have to stage whether the cancer is localized only to the prostate or it has gone to other parts of the body. So conventionally, to stage the systemic manifestation of the disease, we used to do a bone scan or a CT scan of the chest and abdomen. But now it has been found that PSMA scan, which is a PSMA PET CT scan, is much more sensitive and specific for the staging purposes. So this is the most common test used. So the algorithm would be that you do an MRI, confirm it with the biopsy, and then do a staging with the help of a PSMA PET CT scan.
Okay. So now, Dr. Jindal, can you just throw some light upon the management part, like what all modalities of treatment are available for prostate cancer?
So the treatment is extremely complex, but to simplify it, basically depends upon the stage of the disease which we are dealing with. So if it's localized only to the prostate and it's a good risk cancer, then robotic surgery is one of the benchmarks by which you can actually cure the patient. If the disease is slightly outside of the prostate, or the nature of the disease is not a good risk natures, or it's an aggressive cancer, then we tend to give them radiotherapy. If the tumor has spread to multiple parts of the body, then there is no point in giving radiotherapy or surgery to these patients. So then we add systemic therapies in the form of, there are certain medications available which are called abiraterone and enzalutamide. We give them hormonal treatment, and we might give them chemotherapy also, depending upon the number of sites the patient has metastasis. The overall outcome of the patients also depends upon the stage of the disease which we are dealing with, but by and large, prostate cancer, if treated correctly, is not a very bad disease to be treated.
So even the surgical modality, what do you prefer, like the open surgery or the robotic or the laparoscopy, the minimally invasive approach, and post the surgery, the minimally invasive approaches also? How are the rates of urinary incontinence or continence go, like in the patients?
Right. So the conventional methodology by which the prostate cancers used to be surgically operated was called open by the open approach. This was called the open radical prostatectomy. So the entire literature basically generated from there that the surgery is actually beneficial for these patients or not. So, but now, because open surgery always encompassed a big incision, it was a painful surgery, there were more chances of urinary leakage, because once we remove the prostate and do the anastomosis between the bladder and the urethra, the chances of urinary leakage was extremely high. The post-operative recovery times used to be very long. So the world then moved to a minimally invasive approach. So the minimally invasive approach was laparoscopy, but the laparoscopic per se for the prostate is an extremely complex surgery, and it takes lots and lots of cases for a surgeon to actually give very good outcomes, because the suturing, the dexterity of the instruments is not there. So then came the era of robotic surgery, and which has completely revolutionized the treatment of surgical treatment of prostate cancer, and the results have been fabulous. The learning curves are not very high, so any surgeon with a decent experience would be able to give you very good results. In the open era, the learning curve said the person to give very good outcomes, at least he had to be performing at least around say 70 to 80 surgeries, but with robotic the number has come down to around 25 to 30, and you can give as good results as anybody in the world. So it has definitely made the difference on the management of the prostate cancer. The outcomes have also become very fabulous if you're using the robotic platform, because the patients are technically pain free, they have very small incisions on their body. We are able to discharge them within 48 to 72 hours of surgery. The blood loss during the surgery has tremendously come down, and the recoveries are faster. We are able to remove the catheters faster. The need for hospitalization or re-interventions has definitely come down because of the presence of robotic.
Right. So my last question to you, Dr. Jindal, is like how, I mean, the prostate cancer, how does it affect the lifespan? Like, is it a very, like, it affects the lifespan of the people who's suffering
Right.
from them?
So prostate cancer per se is not a very malignant, very aggressive kind of a disease. So even if the person has a last stage disease, so if just imagine if you have a kidney cancer which is in stage 4, the average survival would be say 6 to 12 months. But in prostate cancer, if you're treating that patient properly, the survivals might go up to 5, 7, 10 years. So it is not a very, very aggressive cancer. In certain stages, I mean the early stages, if you are able to remove the prostate completely, or if you are able to irradiate, the survivals are as good as whatever normal survival would be. So you are completely cured of cancer. In the advanced stages also, the survivals are not dismal. So it is one of the best cancers to have if you are treating it properly. But the bottom line is that you have to treat this cancer properly.
Thank you, Dr. Jindal, for the enlightening session that you had with us on this Prostate Cancer Awareness Month. So my last message to the audience is that this cancer is the most common being in the male population, and the normal symptoms like urinary frequency, nocturia, obstructive symptoms, if there, you do report to your urologist, and it is a treatable condition. Thank you.
Thank you so much.